It's your daily reminder you are here to serve and protect. Honor those who came before you. This badge means you belong to a family that understands the days that nearly break you and the days that make you.
Good morning. I'm Dina DiOrio, Mecklenburg County Manager. I want to thank you all for being here on Friday, March 27th, 11 a.m. for our COVID-19 update. First, I want to really thank everyone for their ongoing cooperation and patience as we work through the first day of the stay-at-home proclamation. We know this is hard, but again, we really encourage voluntary compliance. We know that the higher level of voluntary compliance we get, the quicker we can get through this. And so again, we appreciate all of your cooperation. I'm joined today by Gibbie Harris, our Public Health Director, Fire Chief Johnson, who will provide an update from the EOC, and Deputy Chief Jeff Estes from CMPD, who will provide an update on enforcement activities. Just to give you a little bit of information around county services continue for the most part. The vast majority of them are online. We are probably now, as a county government, 80% virtual, but those services do continue. Our parks are open, our greenways are open, our boat ramps are open. We have provided more guidance around golf. We were getting a lot of questions around golf, and so that information is now available. What we're saying is that if you want to have golf, you can have one person in a cart at a time and only one person in the pro shop at a time, and we believe that that will help provide the social distancing that is necessary, but still provide people the opportunity to play golf. A couple other things: we are consolidating operations at our public health clinics. The Northeast Health Clinic on Beatties Ford Road will be closing, and all of those services will, Southeast, the one on Billingsley Road will remain open. Or is it the other way around? Other way around. Okay, sorry about that. The one on Billingsley Road will be closed, and the one on Beatties Ford Road will remain open. So I apologize for that little bit of confusion. The other thing we want to remind people is that our child abuse and neglect report line is still open. That number is 980-314-7700. Please, we want people to be safe, even though kids are home and all of that. So please know that that information is available and that people should report any cases that they believe are abuse or neglect, as well as human trafficking. And so we want to make sure that those enforcement activities continue. On mecnc.gov/COVID-19, people can find a complete list of service changes. We are updating that every time that we have had a service change, so please go there to get that. The other thing I just want to say is you've probably noticed that since Mecklenburg County adopted its stay-at-home proclamation, we see a lot of other surrounding counties following our lead. We think that's important because of the transient nature of our populations between us and the surrounding counties. The fact that we're all going to be working together, working under similar circumstances, we think will help assist in reducing the number of cases that we end up getting here in Mecklenburg County. The call center for interpretations of the proclamation is still open, 8 a.m. to 8 p.m., 704-353-1926. We encourage people to continue to call and ask questions. The more information that we get through those questions helps us provide additional guidance on how the order should be interpreted. And so we appreciate the feedback that we've been getting from people, and we encourage that to continue. In addition, if you see complaints or you see businesses that you think are not in compliance with the order, we're asking people to report those to 311. And at this time, I'll turn it over to Gibbie Harris for an update on the public health side. Thank you.
As of today, this morning at 11 o'clock, we have 259 total cases in Mecklenburg County. That's up from 204 this time yesterday. I want to address the issue of testing. It has been a contentious issue since the beginning of the first case in the United States. It continues to be a challenge for our country and for us locally in terms of making sure that we have the capacity and that we're testing the people that really need to be tested. What we do know is that our capacity throughout the testing process is still limited. So from start to finish, when a test is taken To the time that it is processed, we continue to have some capacity issues. That has been resulting in delays in receiving some test results, and we fully understand the frustration that individuals are feeling about that. Of those being tested, we know that our numbers are increasing more rapidly every day, and we also know that we have community spread across the entire county. All ages are being affected, all areas of our county. As the capacity to test continues to increase, but not enough to test anyone who wants a test, we continue to do widespread testing. We continue not to do widespread testing at this point. We need to assure that tests are available for those who are most at risk, including our first responders, as well as our healthcare workers. This presents a challenge in determining the true extent of this infection in our community. We recognize the fact that the 259 who have tested positive is a smaller number than what we're actually seeing here in Mecklenburg County. The guidance from the CDC and the state on testing is to limit testing to those who are most at risk. They are recommending that those with mild symptoms stay at home. And if you have concerns or issues, to contact your physician, your urgent care, or the health department for clarification on this, but to do it by phone, not in person. In Mecklenburg County, we're also asking everyone who thinks they may need to be tested to use the call-in numbers that are available to them. There are two, both of the hospital systems have telephone numbers on their website. We want you to be virtually screened before you show up for testing. This will help us make sure that the testing is available to those who are in need, but it also will help us prevent the unnecessary use of protective equipment for our providers. Again, virtual assessment is critical. Our data as of yesterday afternoon, which does not include positives reported for today, shows that nearly half of the reported cases were adults between the ages of 20 and 39. We still only have 2 cases in youth under 19. Our demographics have not changed. About 1 in 5 reported cases have been hospitalized at some point in their illness due to their COVID-19 infection. And 1 in 10 reported cases have been released from isolation. So we do know that people are recovering from this and are able to go back to work if they're essential and to interact with others. We know that our hospitals are seeing a steady increase in cases and admissions, but we're also seeing improvement in turnaround time and test results. We're hoping that will continue. We will no longer be providing the map that we initially provided because what we're seeing is widespread infection in this community. We don't want people to think because there are smaller numbers in a particular zip code that it's safer to go there and to interact with others. People need to recognize that we have widespread infection in this community. They need to do what they need, what we've asked them to do in terms of protecting themselves and making sure that they're not exposing others. I want to reaffirm what Manager Diorio said about the order. We need everyone to comply with the order, not to attempt to figure out what the loopholes are in the order so that they can do what they'd like to do. We know how difficult this is. I think a number of you have seen that it's difficult for me. I just pushed my glasses up. I've got my hands behind my back trying to keep my hands away from my face. It's a hard habit to break. But we need everyone complying with all of the orders that are in that proclamation, because that is what's going to help us reduce the spread in this community and hopefully prevent us from seeing what other places in the country are seeing right now, which has been devastating to those communities, not just from an economic standpoint, but from the number of deaths they're seeing as well as the number of people infected. So just please be part of the solution and work with us on this. We greatly appreciate it. Thank you.
Good morning. The Charlotte Mecklenburg Emergency Management Emergency Operations Center has been open for well over 2 weeks. We have representatives from city, town, and county representing their departments. We also have CMS and representatives from Novant, Atrium, as well as nonprofit organizations. We continue to work to coordinate our response to this pandemic here in the county. Our call center, as already mentioned, is open from 8 a.m. to 8 p.m. Monday through Friday. We had significant call volume early on in the week. It has slowed, but we encourage you to call that number. Again, the number is 704-353-1926. This way, we're able to get you a centralized, consistent answer to the questions you may have regarding the stay-at-home order. We're also collecting information on volunteers, those that wish to volunteer here in the county. That number is 704-432-4127. We're capturing anyone that wants to volunteer as well as donate anything to the response to this particular situation. Within the coming days, we hope to have a website up and running that will actually help in capturing that information. We will have that information out through our joint information center as soon as that is up and running and stable. The state is also wishing to capture information about healthcare providers that wish to volunteer. You could go to the North Carolina Emergency Management website and to volunteer and to give your contact information for that purpose. We will have that on the Mecklenburg County website later on today, or you can, like I said, go to the North Carolina Emergency Management website. We are here to provide support to the county for the stay-at-home order. We are in full support of trying to flatten the curve from this pandemic. So please, again, as Ms. Harris has stated, do not try to find a loophole. Let's make sure that we follow the rules as intended. Right now, I'm going to have Deputy Chief Jeff Estes come on up from CMPD. Thank you.
Thank you, Chief Johnson. We also want to echo our admiration and the leadership from the emergency management, everyone in the Charlotte-Mecklenburg area across the county for their reaction and leadership during this pandemic. From the CPD's perspective, a couple of things. One, as far as enforcement goes, we are very pleased at what we've seen so far from all Mecklenburg County residents. Most people are doing the right thing. Those that aren't, I think you know who you are. We encourage you to do so. Second is that we have reached all across the county. All law enforcement agencies are on the same sheet of music, enforcing the order in the way that we have outlined early on, which is on a platform of education and dialogue to ensure people know who can be out and who can't on a broad platform. If so far we've received about 1,200 or so complaints about the stay-at-home order or mass gathering part. We're vetting through each one of those, giving each one their due regard and investigating those as necessary. Again, people can call 311 if they have questions or complaints, or go to cmpd.org, and we have a link there where you can enter what's called an EMER request for us, and we'll get them to the right area. That's no matter where you live in Mecklenburg County. If you have an issue or complaint, you can go there and we'll get them into the right place. So far, so good. Thank you so much for all your efforts. I'll turn it back over to the county manager.
Thank you, Deputy Chief Estes. At this time, we're prepared to take any questions that you may have.
Claire Donnelly from WFAE. We have been getting some questions from some of our listeners about whether it is too late to flatten the curve, if some of this is coming, if some of these orders are coming down too late.
I'm going to have Gibbie Harris answer that.
Great, thanks.
Unfortunately, this is a situation where we don't have a lot of experience. This particular virus is something that we're learning about daily. But the indications from those places that have put orders in place early have indicated that those orders and staying at home, social distancing, physical distancing, all of those things do have a positive impact. And that is why our entire community decided to move forward with the order that we did. We are already seeing way more cases in this county than in any other county in the state, but we still feel like we have some ability to reduce and flatten that curve. And so, again, we want to encourage everyone to help us do that.
Can you talk about when you would expect the stay-at-home order to be lifted, or when you would see how long it would be extended for, and assessing when that curve is really going to hit its peak?
Again, we're working on the modeling. We are collecting data that will help us with that to try to predict. But again, it is a model and it is a prediction. As I heard someone say yesterday, we don't know what this virus is going to do. We are trying to use the data that we have available to us to help us make some somewhat educated guesses on this, and we're doing the best we can with that. Currently, this order goes for 3 weeks. We will assess as we move through those 3 weeks to see what the data is showing us and what we believe we need to do, whether that time needs to be reduced or extended, and we'll make sure that we keep the community informed.
This is Glenn Perkins with Q City Metro. You said previously that as we tested more people, we would see these numbers rise. Are we able to tell if that is what's happening, or are we seeing community spread? Are we able to determine how much of this is simply a factor of testing more people?
Based on what we're seeing in our hospitals and the number of admissions, that continues to rise as well. I don't think that's just a matter of testing more people. We are testing those folks that are showing up who have significant symptoms and are having some significant healthcare issues. So I think that should be for us a way to monitor what's going on in the bigger community. So as those numbers continue to rise, we expect that those individuals who are infected in our community with minor symptoms is going up as well.
Ms. Harris, do COVID-19 tests have to be sent to the lab right away for them to be accurate? So, like, for example, would it be problematic if a test wasn't sent to the lab for a week after it was taken?
I can't think of a reason why we would hold on to a test for a week. Those are sent to the lab and preserved in the way they need to be preserved to then be processed. So I do believe that that's being done in the proper fashion and under the regulations that are in place for testing.
I'm not talking about a specific incident that occurred at the health department. I'm just asking if the test should be sent to the lab right away after they're conducted.
That is standard practice.
Ms. Harris, Caroline Hicks with WBTV. Kids are still using playgrounds because the parks are open. When will those get roped off? And are there any plans to close the rail trail in South End?
Do you want to?
I can go ahead and double check on the playgrounds. They were supposed to have been closed off already. So thank you for letting me know that they're not, and I'll make sure our Park and Rec folks get on that. At this time, we don't have any plans to close the rail trail, but it's certainly something that we can evaluate and look at. And if we think there's an opportunity to do that to help with this effort, then we'll certainly take a look at that. But I will double check on the playground. So thank you for that.
Dina, Ruben Jones from Spectrum News. Let me just add on to that. Are there any plans? We've seen in some cities that have actually cut down basketball hoops. We've heard of some people playing on basketball hoops locally. Any plans to do anything with that?
There are no plans at this time to cut down any basketball hoops. But again, we've told people that if they want to go out and exercise, getting into, pick up basketball games and bumping into each other is not considered appropriate social distancing. And so, to the extent that we can monitor that, we will, but we don't have any plans at this time to cut down our basketball hoops.
And Ms.
From Channel 9. You mentioned that boat ramps are still open. Are you concerned that now today and into the weekend, we're expecting temperatures to reach into the 80s, that you're going to see people who are going to start getting on boats, getting out of the water, going to the sandbar areas and, not practicing social distancing? And what are the plans from that side of things as far as enforcement goes?
I'll let Gibbie talk about the social distancing as it relates to boating, and then we can see if we can answer the other question.
So we had gotten a question earlier about boating and whether that was acceptable. The boat ramps are open. Obviously, only one boat at a time can be loaded and unloaded, so I think that helps with the social distancing there. And the expectation is that boats are not overloaded with people. We're still asking for folks to social distance. 6 feet is the distance that we're requiring. I don't know exactly what kind of enforcement we may or may not do if folks start hanging out on beaches, and we'll let Chief Estes talk about that.
Very quickly, this issue, like the rest of them, we have officers out on boats, and if we see big mass gathering like that, we'll enforce them. We'll enforce the proclamation and make sure that they are practicing, the safe distancing area. Simple as that.
This is Caroline Hudson from the Charlotte Business Journal. I have a question for Gibbie.
Yes, ma'am.
At this point, how concerned are you about the preparedness of the hospital systems here and the potential that they might be overwhelmed as more and more people test positive?
We are having meetings almost every day to discuss with the hospital systems their preparation and where they are in that process. Our hospitals have done a great job of reducing and eliminating elective surgeries, elective visits to the hospital. They are looking at their capacity and providing that information through the EOC so that we can look at it for the county as a whole. We're in conversation with them about their plans, and we're also doing planning past their capacity just to make sure that we can respond if and when the time comes up. So right now, I am comfortable with where they are. The numbers that I'm seeing every day tells me that they've done the preparation that they can, and that we are in a position currently to do what we need to do in this community to take care of the individuals infected.
Gibbie, this is Brett Jensen with WBT News. Just wondering, in terms of projections and numbers, I know a congressman is trying to get numbers and projections from the two local hospitals, Atrium and Novant. He can't get them from them. Have you seen, can you give us any projections in terms of numbers, what you guys anticipate?
You mean numbers of people admitted to the hospitals?
Yeah, or just numbers of people that we anticipate to be infected within the county. Because South Carolina is releasing numbers. They're saying, over 2,000 within a week, over 8,000 by the end of April. Can you give us any projections?
We are working with the hospitals right now on those projections. So I would hope that by early next week, we have some agreement on what we think those might be.
Is there disagreement then as what the numbers are reading?
No, it's just that there are any number of models out there that predict, and we're agreeing on the model as well as pulling the data that we need to have to make those decisions. So we should have that by early next week.
Gibbie, I had a question for you too related to hospitalizations. Can you tell us about the cases that have required hospitalization? In other words, how old were these patients? Did they have any underlying medical conditions, et cetera?
I can't give you specific numbers at this point, but I will say that a large number of the ones that are admitted to the hospital are in the older age range and have underlying health conditions. I don't want that to downplay the fact that this is serious for all age groups, but those are the ones that, as we have said from the beginning, are most seriously impacted with complications from COVID-19.
Gibbie, going off of that, when you talk about the numbers, there are significant, as you said, looking at the last numbers, 80% of the people who have this virus in Mecklenburg County are under the age of 60. That's different from what we heard from doctors early on in this. Why do you believe that is, and is there any message you want to get out there to young people?
I believe the message in the beginning spoke to the older individuals and those with health conditions because of the seriousness of and the impact. The other issue in the early stages, we just didn't have enough testing to even be able to say how much was impacting younger age groups. I think what this shows us is that it's easily spread, and our younger folks in our communities are very social. And so, unfortunately, that is where we're seeing a lot of our cases. Again, we do have younger individuals who have underlying health conditions. So just because you're in your 20s or 30s does not mean you're safe from some of these more difficult health conditions that or reactions that people are seeing to the infection. So the message is we are all susceptible to COVID-19. We all need to be conscious of the fact that we have community spread. It is throughout our community. We all need to be thinking about what we need to do to social distance, to physical distance, to make sure that we are doing the things we can to protect ourselves individually, but also being concerned about others in our community that we could infect if we had the infection. So I want everyone of all ages to take that message to heart and to do what they can to help us get through this more quickly.
About how many cases are due to community spread? And then I've been getting a lot of questions about Advil. Is there any truth to the rumor that ibuprofen makes your symptoms worsen for COVID-19?
I have not heard that. I'll take a look, research that a little bit. I have not heard that from any medical professional at this point in time, that Advil or Motrin makes it worse. And what was the first part of the question? I'm sorry.
About how many cases are due to community spread? Is it still a third?
I believe at this point it's much higher than that. We're probably well over half of our, especially our new cases, most of those are related to community spread at this point.
Gabby, you said testing remains limited in Mecklenburg County. Can you give an update for the availability of testing and how that compares to, say, a couple of weeks ago?
I don't have specific numbers. We are starting to track the number of tests that are being done every day, but it's difficult for us to relate that back to what was happening a couple of weeks ago because we didn't have that information. So we're starting to watch the numbers go up in terms of the ability to test, but at the same time, really staying focused on those individuals who need it the most. As our numbers increase in the county, those who need it the most is probably going to go up as well. So even though the capacity is increasing, we are not at a place where we can offer it in a widespread fashion.
Have you do you have any concerns about patients who may get false negative tests? I interviewed a doctor from Tryon Medical earlier this week who said he has seen a couple of patients who, based off of symptoms and being flu negative, he was pretty convinced had COVID-19, but they actually tested negative for it. Have you seen cases like that happening? And is that a worry for you?
We have had several cases of individuals who tested negative and then obviously had the symptoms and were then hospitalized for those symptoms and were treated as if they had COVID-19. So yes, that is a concern. But the other challenge that we have is we don't have a specific time frame from when an exposure might have happened and when that person was tested. So it's possible that those individuals developed the symptoms and it had not been long enough from the time of exposure to have a full positive test. So I think our physicians, our clinical providers are taking a look at that carefully. And if they have individuals who are sick enough to be in the hospital, considering whether they may have it, whether they tested positive or not. I think, again, the message, though, for most individuals is if you have mild symptoms, flu-like symptoms, if you can, if you're not too sick, stay at home and just act as if you have it rather than seeking testing at this point in time.
How does that
so President Trump said on Hannity yesterday that there is no way he would cancel the RNC in Charlotte. I just wondered if county officials had any comment on that.
We did see that. I saw that earlier today as well. That is not until the end of August. There's a lot of months and things that can happen between now and the end of August. And quite frankly, we're not really looking that far down the road. We're really trying to get through the next several weeks and see if we can flatten the curve and slow the spread. So I'm sure there'll be future conversations around the RNC, but not today, not for us in the city and the county. That's kind of where we are.
Have you gotten any additional guidance from the state on how to implement surveillance techniques?
To date, we haven't gotten that guidance. We know that they're working on that and trying to figure out what the best possible approach to that will be. And that is a particular issue that we would like to see a statewide approach as opposed to a Mecklenburg County approach, if at all possible. So we're having those conversations with the state. They are working through that, and hopefully that will be presented to us shortly.
Earlier this week, national authorities recommended that people leaving New York self-quarantine for, I think, 14 days. We have a major airport here. What's being done, if anything, to identify people who coming from New York, or do we have any idea any impact they may be having?
We don't have any impact that we know of. We don't have any idea how many are coming in from New York. We're not screening at the airport. They're given that information before they leave New York. They're being asked to self-quarantine for 14 days when they reach their destination. And again, we are hoping that individuals will take that seriously.
Allison from Channel 9 again. Have you had or heard of any cases where people are coming from out of state to Mecklenburg County because they can't get treated in places like New York and then seeking care from hospitals here?
We don't have any specific information that indicates that's happening here. We do know that our hospitals in Mecklenburg County serve people in our surrounding counties. So we do know that we have individuals with COVID-19 from other counties in our hospitals at this point in time. That's not unusual, but I don't have any knowledge of specifics from other states that may be coming in for service.
Gibbie, do you have any update as far as how many tests are pending in Mecklenburg County right now?
Not at this point. We still know that it's quite a few, but as I mentioned, we are starting to see some increase in or some decrease in the amount of time it's taking to get test results. So we believe that number is going to be diminishing over time.
Gibbie, I apologize.
So we have time for one more question, okay? So who's up?
Gibbie.
If I could jump in real quick, we've heard from a number of officials in different states about ventilators. Has Gibbie been in touch with health officials here in Mecklenburg County at the area hospitals to kind of get a handle of the number of ventilators we have and what projections are based on how many we might possibly need?
We are getting information from the hospital systems every day about the number of ventilators they have available, how many people are actually using those ventilators, and what their additional capacity is. At this point, we have not made an additional request, but we are assessing that right now with our hospital systems, and we'll make the appropriate requests up through emergency management to the state and to the federal government.
Okay, thank you everybody for being here. We'll let you know when we'll have our next media availability. Have a good day. Thank you.